So I'm Dr. Bill Reiner. I'm a child and adolescent psychiatrist, and I'm also a retired urologist. Now that's a strange combination. That's good for another talk. But today I'd like to talk to you a little bit about interventions for promoting adaptive skills and coping skills in the kids, especially if they're your kids, and especially if they're going to have surgeries or some kind of procedure for bladder exstrophy. Coping and adapting are actually very difficult and very complex skills that we learn with age and more experience, which really says that as we develop, or as your kids develop, they will improve their coping skills just by the fact that they're getting older. They have more experience, their cognitive processes will improve, their ability to think things through, and in general, the way that we model those things for them at those various ages are very important. Now, there are limits on how much improvement one can get simply from our own personal development, especially in kids who have experience with surgeries and procedures, which can make it very difficult. Let me get into that in a moment. One of the things that we like to do is to try to use preventive measures, or as people like to say, preventative measures, in terms of having maladaptive or ill carried out coping strategies and behaviors that don't work because they're not good for the particular surgery or procedure that a child is about to endure. That's a bad word. Deal with. I think the important thing is that we can use educational techniques. And these are educational techniques that are appropriate for a given child. And for that matter, the educational techniques for their parents are also important because they'll have to learn many of these ideas and concepts themselves. Where do we learn them from? We learn them from other parents who've been through these things and other kids who've dealt with these issues. So the important things for kids with exstrophy are in particular psychosocial education and ultimately, as they get older, psychosexual education. But the specific modeling that we do in helping them get into these kinds of educational skills depends on us. And it's very important that the parents and the other adults either use good modeling or figure out with help from others how to model appropriately. Some of us are much better at that naturally than others. And there's nothing wrong with admitting that you're having problems or even thinking that you're having problems if you aren't, and asking for help from others. All of this really takes into account that we have to recognize the age of our children or of our child and the age appropriateness of any given technique or education. And the real reason there is that if we overdo it and we overestimate, we're going to get very little in a positive response from our child. They simply aren't going to understand what we're talking about or what we're trying to do. So if a child's very young, we have to be very simple, very brief in our statements, and very concrete. We can't use a lot of adult style of interpretations or adult style of comparing one thing to another, because they're not very good generally at doing that unless they're very concrete examples. Now, one of the issues that's important is that if a child has a lot of prior experience for surgery, even if this surgery is totally different, and a lot of prior experience with the anxieties of procedures, it's going to be much more difficult to help them cope. And you have to play this by ear to some degree. Each child is going to respond differently. There's always those kids who seem to tolerate a lot, and then there's the rest of us as kids who don't tolerate very much at all, and all the rest of the people are somewhere in between. So parent involvement is often very, very important with surgical and procedural experiences. Sometimes parents are not very good at responding and get very anxious themselves, and sometimes that parent might do better if they stay out of the procedure and away from the surgical aspects and let another parent or perhaps even another family member take their place. That's, again, very individual, and all of us need help in recognizing which of us as parents have those issues. So we have to be careful to understand whether we help our child or whether we're going to hinder them if we get involved. The other aspect that can be useful is to do a systematic desensitization, which is a fancy way of saying come up with a plan to expose your child to what they're going to go through, but gradually, not all at once, which can be horrifying to a child. Although sometimes very effective, it still can be horrifying. So we can gradually expose them to the beginnings, especially if they have exposure to surgery before. Expose them to the kinds of things that they will deal with in the operating room or in the pre-op anesthesia room, the kinds of people they'll deal with, what the people will be dressed in, what they'll look like. Today it's pretty easy to get surgical scrubs and probably even a surgical hat, and certainly easy to get a mask. So it might be good for a parent to demonstrate that and show your child that this is a real person underneath this. It may look a little strange. He or she may look a little strange in the outfit, but it's a real person and they can relate to that person as a person. So in that way, you can begin to expose your child to the people that they'll encounter in the operating room. And if you can set it up with your surgeon and your anesthesiologist in advance, they can maybe go visit at an off time when there's not much going on. They can see the nurse, see the doctor, see the other people moving around, the orderlies who may be moving the beds. And it might be useful for them to lie down on a gurney and look up at the ceiling because, of course, when you go to the operating room, you're typically lying down looking at the ceiling. You don't see a lot of else, which is kind of a strange experience for adults, let alone for kids. And then I think at some point, it's worth trying to expose your child to the operating room itself. And probably the easiest way to do that is to go into an operating room that's mostly empty, so they can see it's a big giant room that makes a lot of noise if you yell, and it's very quiet otherwise. And then as people move around, they can see that people are in it. And then gradually expose them to some of the equipment they'll see and deal with, such as the anesthesia machine, which is the big scary part. I'm not sure I'd go in too much to putting a mask on them or so. I think the anesthesiologist probably can handle that a little bit better. Because pediatric anesthesia people typically have a lot of experience at gradually getting kids into it. And sometimes it's important to realize that the parent's mental health itself can play a role in their child's mental health and their child's ability to cope. So again, these are individual things that we have to recognize ourselves, and we have to try to deal with those in advance. I think the final thing that's important is that family cohesiveness is very important. Hopefully that will mean two parents or a grandparent and a parent or a couple of adults, because it's always tough for just one to deal with this. But sometimes siblings can be part of that cohesiveness. Sometimes parent siblings, uncles and aunts can be helpful. So I think it's important in getting children ready to deal with these kinds of situations, getting them to figure out how to cope and how to adapt. I think it's important to use whoever you can and to use whatever you can, whatever's available. And for a lot of that, you're going to have to inquire. The operating room is a good example. Can you take your child at some off time to see some of that and deal with some of that in advance? I think that can be very helpful. I wouldn't do it 3 months in advance with a young child because they're not going to remember much. But again, you have to work on that based on the age appropriateness of a given child. And hopefully, using these techniques, you'll have some benefit in helping your child to get through these difficult situations, which will also help you to get through these difficult situations because they're difficult for you as well as for your child. Thank you very much.